Hi, my name is Nadia, and for my presentation, I'm going to be focusing on human papillomavirus, more commonly known as HPV. So, what exactly is HPV? It's a group of more than 150 related viruses that infect the skin. So, this is a problem in society because 79 million Americans are infected with HPV as of right now. Given this very large number, it's a very common disease, one that nearly all men and women get at some point in their lives. So how does infection happen? Infection occurs when a virus enters the body, usually through a cut, abrasion, or small tear in the skin. Genital HPV is spread through vaginal, anal, or oral sex with someone who has the virus themselves. Now, infection can still be passed down even if the infected person shows no signs or symptoms, which is a very common thing, as symptoms can show up years later after becoming infected. Exposures are also dependent on your sexual behavior, including your contraceptive methods, your lifetime, your number of sexual partners, and the age at which you first began having sex. So where does infection occur? Infection occurs globally as this is an STI, so sexual intercourse can occur anywhere. So yeah, it's globally. However, it is important to note that HPV is the most common sexually transmitted infection in the US. So what are the risks for the community associated with HPV? The virus itself is very harmful, but if HPV doesn't go away on its own, it can lead to cancer or genital warts. Now, warts themselves are very contagious, so they pose a great risk to the community, as well as cancers. So the primary cancer that HPV causes is cervical cancer, which infects many women. However, this is not to say that only women are infected with HPV cancers, because cancer can also occur in the penis or anus due to HPV infections for men. Who's at risk of attaining HPV? So anyone who's sexually active can get HPV. However, teens to young adults are most prone to contracting genital HPV, as a new study found that about 50% of new genital HPV infections occur in 15 to 24-year-olds each year. How do we solve this problem? There's no treatment for the virus itself. However, we have treatments for the health problems that HPV is associated with. So we're going to tackle these in two strategies. The first strategy being HPV vaccinations. So vaccinations are super safe and effective. So these protect against diseases, including cancers caused by HPVs, when given in the recommended age groups. So this means that they're most effective when given to when you're 11 to 12 years old. The second strategy is to practice safe sex. This means using condoms the right way every time you have sex, regardless if you're using any other contraceptives, as well as only having sex with a limited number of people, as this limits your exposure to HPV. Now, how is this problem being solved in other countries? Well, in developing countries, they actually have new HPV vaccine deals that are making it very affordable for girls to become vaccinated against the disease. So the vaccinations are being given for a low rate of $4.50 per dose, which is incredible because in developed countries, these same vaccinations are cost more than $100. So that's a great deal, and that's awesome for them because they're getting these girls vaccinated. The second example we're going to use is Australia. So Australia actually just came out with a new screening program for cervical cancer. So this test replaces their pap smear that Australian women usually get twice a year. However, this test looks specifically for the human papillomavirus, and it's only required once every 5 years, and it is planning to reduce cervical cancer rates by at least 20%. So we're going to look at HPV prevention for the future. So what does literature say we should do? Literature, all research points to preventing ourselves from the diseases that HPV can cause, as there's no treatment for the virus itself. So this means that we have to prevent ourselves through the methods I already talked about, such as being aware of our sexual behavior, getting those vaccinations, as well as getting screened for cervical cancer, as cervical cancer is the most preventable cancer there can be. So there's a lot of importance placed on these two tests, the PAP test and the HPV test. So what's my personal opinion on these methods? I strongly agree with these with what research has shown, that these methods are the way to prevent this infection from infecting all of us. So I think it's incredibly smart to be aware of your sexual activity and limiting the number of partners you have using condoms, as well as getting screened for pap tests and HPV tests to find any initial signs of cancer, as well as if you have a child, getting them vaccinated when they're 11 to 12 years old to prevent them from becoming infected in the future. And these are my references, and that's pretty much it. Thank you.